He was the mayor D. Did he get the mayor D? Yeah. But the drama was very, very hard to find the information out. He made his life hard as a Caucasian guy, even though obviously had nothing to do with that. That was a big part of his life. The assassination.
Maybe the Wall Street Journal will cover it.
Catherine, can we have a short meeting afterwards?
Yeah.
We have any no shows?
Maybe one. But I had 4 in Good afternoon and welcome to our Kiwanis Club June 21st meeting. I don't know why it is just on my picture up there. Let me fix something over here. Okay, now I don't. Why would not working here? Okay, we'll go with that. Okay, welcome to our June 21st meeting. We're going to begin with a prayer and our Pledge of Allegiance. So if you'll stand and join me, we'll have our invocation. Let us pray. Lord, as we eat, help us to remember your provision and your goodness. May this time be more than food to us. Let it be a time to share with others and enjoy the blessings of friendship. Let it also be a time to remember those who hunger and a time to dwell on your sacrifices for us. As we eat, help us to remember your provision and goodness with thankful hearts. Bless this food to the nourishment of our bodies and your bodies to our bodies to your service. Amen. Now if you'll join me at the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. I want to welcome everyone. We have several people who are here with us today who we haven't seen since pre-pandemic. So for those of you who are able to join us, we're so happy to have you here. I've said this before, when I do the RSVPs, I get really excited when I see a name I haven't seen in a long time. So it's just so wonderful to have everyone back. So for our moment in history, I'm going to continue on with our sort of National Day. If you remember last time, it was National Chocolate Ice Cream Day. So hopefully people went out and got themselves some chocolate ice cream. For today's history moment, I'm going to share with you another National Day. So thanks to social media and the smartphone, June 21st recognizes a form of self-portrait that would not exist without them. Yes, it is National Selfie Day. While the act of taking a selfie may predate social media, smartphones, and the world itself, the popularity of taking these self-portraits keeps increasing, and the ability to take them gets easier all the time. With selfie sticks and multifunctional camera phones, it is all too easy to take all kinds of photographs, and even group selfies. While people have been taking pictures of themselves for quite some time, most experts agree that the selfie first evolved into its modern version when people started taking pictures of themselves to post on MySpace between 2003 and 2005. However, it was a drunk Australian on Flickr in 2004 who coined the term selfie to describe the act of taking a picture of yourself and posting it to social media. Then, as years passed and cell phone technology, as well as independent technologies and various social media outlets improved, selfies themselves began to improve. And as they improved, they increased in popularity. In 2013, selfie would hit the mainstream when the Oxford Dictionary added the term selfie. The first time National Selfie Day was celebrated was June 21st, 2014. It was started by DJ Rick McNeely as a way to get people to enjoy taking selfies of themselves and to do it in a creative way. Not long after he invented it, the holiday took off. So if you want to celebrate National Selfie Day, all you have to do is take a selfie of yourself and post it to social media using the hashtag National Selfie Day. Just be sure to take a good pic and don't go overboard with the selfie stick. Now, I was thinking, we are trying to make sure we're getting our attendance up at meetings. So it would be great if you had your smartphone and took a selfie of you and maybe your table, and then you can post it on Facebook or Twitter or Instagram or whatever you might do and put like hashtag Kiwanis. Except look, Derek's doing it, Lori's doing it. Don't you want to be part of this?
Did you do it on stage in the whole group?
Well, we'll do that at the end. I want to make sure we have plenty of time for Mr. Davis. But we'll try to get a good, I'll put you in charge of that, Jeff. And also want to acknowledge everyone we have joining us virtually. We have a good crowd there as well. So now we're just taking selfies, so it's great. Okay, so we want to do our attendance prize. If you are joining us virtually, we have signed you in. You have your own slip here. And then I'm going to ask Mr. Davis to draw one of our...
Draw a card?
Yeah, draw any card you want. And our attendance prize is actually provided by Chip Madsen. It is a $15 gift card to White Horse, so you can use it to go buy your own bottle of wine or beer, or maybe put it on payment on some other type of spirits. And so the winner is actually Cobbs Nixon. There you go, Mr. Nixon. Sorry, Cameron, it was close, but Cameron's trying to find loopholes as to why he can win.
Neither is Cameron. Neither is Cameron.
Okay, now I'm going to turn the meeting over to our president-elect, Mr. Troy Lanier, who will introduce Mr. Jim Davis.
We're fortunate to have with us today Jim Davis of the University Healthcare System. He joined University Healthcare System in January of 2009, and in June of 2010 was named President and Chief Executive Officer. He has over 40 years of experience as a senior executive in hospitals and health systems. Prior to joining University Health System at Augusta, he worked for Altman Hospital in Canton, Ohio, Mount Carmel Health System in Columbus, Ohio, Memorial Regional Hospital in Hollywood, Florida, and Humility of Mary Health Partners in Youngstown, Ohio. He holds a bachelor's degree in mechanical engineering and a master's degree in business administration from the University of Akron. Please welcome Jim Davis.
Well, thank you very much. We couldn't remember if this is the third or the fourth time I've talked to the Kiwanis, but amazingly, you guys keep inviting me back, which shows you're really starved for entertainment, I think. But I'll do the best I can today. I thought the selfie thing was cool. I've never seen that before. That was a great idea. Selfie. It's always good to have a drunk Australian involved in your meeting. You know, that's a good thing. Also, there seems to be a theme too. Now, Cobbs has something you can go. Cobbs, remember I pulled that card that you won on, so you can help me come over, get a bottle of Opus, we'll share it, okay? Does that sound like a good idea? I'm in on that, so. But thank you for having me today. We've kind of been in the news lately, so I thought I'd update you a little bit on what we're up to. Again, my last visit was back in March of 2019. And at the time I talked to you about hospital consolidation. What's interesting is some things happened in the middle of all that. We've had this COVID thing. I'm really happy to tell you we're down to 5 patients in the hospital today, by the way, which is wonderful. You know, at one time we had 154 at our peak. And yet people are still getting it. We had 20 positive COVID tests last week. We only test folks that are actually showing symptoms. So the bug is still kind of floating around out there. So do be careful still, even if you, hopefully everyone's been vaccinated. If you haven't, you should be. I can set you up, or Lori can set you up with some vaccinations. But it's important to get vaccinated. It's a dangerous bug. We had 1 death even last week. So I think all told, we've had 431 patients pass away from COVID since this all started. But on the other hand, we've treated 3,500 inpatients in the meantime that we discharged back to their lives and their families, and hopefully they're doing well. But a lot of that happened since we last talked. And we were talking about consolidation of hospitals at that time. So, you know, you might be saying, so why would universities seek to consolidate into or merge into a system? This is from the slides I gave you back in March of 2019. And I said, you know, the main questions we had: would it improve patient care for the community? Would it improve safety of services? Would it improve the efficiency of providing care? Because the cost of care is getting to be a big issue in this country. Would it result in reduced costs for services to the community? Would it expand access to care? And would it enhance the sustainability of the organization to continue our mission, which is to improve the health of those we serve into the future? Also from that meeting, I said, who would the ideal candidate be? Would they have a shared mission, values, and culture and all that? And that's a big deal, by the way, when you get into discussing things with different organizations. We wanted to see a AA bond rating or better. We're A1. We were just reaffirmed as A1 and A positive with Moody's and Standard & Poor's. So we thought someone that had a better bond rating than us would be a good thing. A high quality provider, A rated by Leapfrog. Significant relevance in the state of Georgia, which is very important in all this, and it has political relevance and business relevance. You know, we look like a big organization when you look across the river here and see our building. We look like a big place. We employ about 4,500 people in this community, but we're small. We're now a big, small hospital in the healthcare business. And so we thought someone that has more business relevance, so they can deal with the payers and the suppliers better than we can, as well as political relevance. And healthcare is still an incredibly political business out there, both on the state and federal level. We wanted people that had common operating systems. We really don't want to have to teach all our doctors how to do some other kind of electronic health record system. Strong clinical connections with us. People that we refer people to would be good to team up with. Commitment to investing in Augusta was very important to us, not just people wanting to take stuff out of Augusta, but people that are willing to invest in Augusta. Commitment to keep monies made here, pre and post merger here in Augusta, which we think is incredibly important. And then commitment to allow significant local control so that our local board doesn't go away and would still be very involved. And we didn't want to join up with someone that we thought would be a stepping stone. Remember, these are slides from 2019. So at that time, these were my parting words to you guys. Consolidation is a definite trend in the nation. Headwinds for the not-for-profit healthcare sector, I'll throw in the for-profit healthcare sector for that matter, are strong. And for both independent and systems, but the systems have definitely an edge up on all of us. University is a prime target for consolidation. We've had a lot of people talk to us about joining their systems. But independence at that time was a very viable strategy in the midterm and short term. But in the long term, it looked like we probably have to join up with somebody. And nobody can predict the long term in healthcare. If anyone does tell you, they can tell you where healthcare is going. Don't believe them. They probably don't know what they're talking about. I told you, we only get to do this once, so we wanted to make sure we did it right. And I told you, you can always trust us to do the right things for the right reasons in the right way, as we've always done here at University. I think I think we have a great track record for doing the right things. So what's impacting hospitals today? Aging of America. We're seeing folks, I'm a baby boomer. I just turned 65. So I'm one of those aging baby boomers. And, we're all sliding into that Medicare age. And two things are happening there. One is, if you go back to the Affordable Care Act, which passed in 2010, the whole thing around the Affordable Care Act was to reduce what they compensated hospitals for Medicare patients and take those savings and apply them towards expanding Medicaid so that everyone in the country would have health insurance. And the hospitals across the nation were willing to do that because it eliminates all that uninsured coming in your ER. So everyone would have insurance, all that was great. And that all worked great for about 3 months until the Supreme Court got involved and said, you don't have to expand Medicaid. And yet today in the state of Georgia, and I believe South Carolina too, Medicaid has not been expanded, but, and I showed you the slope of pain the last time I talked to you, the cuts to Medicare towards hospitals continues to this day and will continue through 2024. The last year we were in was the total impact our organization, just University Hospital, is $44 million a year in less federal support for Medicare. That adds up over time and it keeps growing every year. So that's a big issue for hospitals. And then the rapid expansion of Medicare Advantage plans. And having just turned 65, the first ads you get when you turn 65, at least my first one, was walk-in tubs. That kind of changes your life, when they think you're a candidate for a walk-in tub. But the next batch that shows up is the incredible amount of PR and advertising coming through your mailbox for Medicare Advantage plans. And the advertising is very compelling. Now, let me tell you who makes out on Medicare Advantage, and it's not hospitals. On Medicare, we lose about 10% of our cost on Medicare at the hospital. That's actually very good compared to a lot of hospitals. On Medicare Advantage, we lose 30%. I mean, it's to the point where I don't want to do any more Medicare Advantage plans. But they're huge. They're about 50% of our Medicare business runs through Medicare Advantage. But that's a huge downward pressure on net revenues in hospitals. Shortage of talent, that's probably true in every business today. But nurses have been in short supply for a long time. It gets worse as we go forward. Georgia's actually 6th worst in the country for having enough nurses to cover the demand for nursing. Physicians, it's getting very hard to find some sorts of physicians. How many of you found a rheumatologist roaming around lately? I think we're recruiting 2 right now, but there aren't any. They're very hard to find. And I just threw the other one in here as everybody. It's hard to find housekeepers today. It's hard to find food service workers today. It's just very difficult to do. And what that means is the upward pressure on wages is enormous in hospitals right now. And 57% of my business is wages. We're still a very highly labor intensive business. It's not like some businesses that can automate. We still have to actually see patients and move them and do all that sort of thing. So that's a tremendous upward pressure on our cost. So that makes margin pressure. When you have pressure on the revenue coming in, going down, and you have pressure on costs going up, it gets to be a tough place to make the ends meet. I also threw on here fallout from the COVID-19. That is not something I talked about with you guys the last time because it didn't exist. And despite tremendous federal funding, and they coughed up a lot of dough to hospitals, it didn't cover the cost. To date, I think the last numbers I remember is this has hit our hospital to the tune of 127 million in lost net revenues and increased expenses, and the federal government support was 52 million. So clearly far short of what the impact was on our hospital. And still some reluctance on folks that return to hospitals today. Our business is off about 6 or 7% still compared to where it was in pre-pandemic times. That's a big deal when you run such a tight margin as we run. So a lot going on. I always like to quote the major business advisor, Mike Tyson. You know, remember Iron Mike, you know, and while, you know, when you're saying that we're going to be good in the short term to midterm, everything's going to be great staying independent. Mike Tyson's thing was, everyone's got a plan till I smack him in the face. COVID-19 can smack you in the face if you're a hospital. So what's all the consolidation stuff about? We've actually been studying this since the Affordable Care Act passed. And you can go back through and look at all our strategic plans since that time. And you'll find something on there about scale and expand and trying to research or do something about consolidation. So it's been going on a long time at university. But it got serious after COVID-19. Why do you do this? It stretches talent, particularly scarce talent, like information technology folks, data scientists, population health people. You can spread that over multiple hospitals. You can do it much more efficiently than you can do it as a single hospital. Developing and managing in the digital age, you know, when we saw what some of these big systems are doing with apps and IT things and artificial intelligence, there's no way our organization can afford to go into that. So we're not able to keep up with that. Systemic cost savings, systems work more efficiently than individual hospitals do. They just do. I've worked in systems and I've worked in individual hospitals. I can tell you it's cheaper to work in a system. Achieve relevance, like I talked about, with the business and the political community, and managing population health risk, which is a big thing that's probably not here yet, but coming. That's where you have basically capitated payments for groups of people. And from what I know, it takes 1.2 million people in your capitated population to be able to do population health risk, reimbursement without taking on exorbitant risk. You need enough healthy people to spread the sick folks over. And so 1.2 million, we only have 600,000 in our whole market here. And that market is divided amongst a whole bunch of healthcare facilities. So to get in that business, we need to be part of a bigger system. You may have read in the paper or heard in the news or somewhere that our board actually unanimously approved a non-binding letter of intent for University Healthcare System, who operates University. I'm not going to get too much into the lease and all that stuff, but we're going to join Piedmont Healthcare System out of Atlanta. This is really exciting news for us. And I think you'll see why here in a second. Why Piedmont? They have a strong commitment to quality and also for caring for folks in Georgia. They have an excellent national reputation for clinical quality and compassion. And they serve a lot of communities throughout the state in a not-for-profit format. We did not want to go with a for-profit organization. Shared culture, they do have a patient-first mission. We will actually become a hub of the main health system. So we'll still have a board and we'll still have our own leadership team here. But we'll fit into the way and that's the way they did it. They have one in Columbus. They have a hub in Athens as well, which allows care to still be somewhat taken care of close to home. Shared commitment to high quality care. They actually have more A ratings than any other system in the state of Georgia. I guess you could say, remember what I talked about back in 2019, I would say Piedmont checked all our boxes. They really hit everything. Now, what are we going to get out of this is, you're probably wondering. Well, first off, we will be a hub. That's an important thing. We're not just going to be taking orders from Atlanta. We're going to be a participant in this whole thing. We'll still be running the health services here in the community. We're going to leverage Piedmont's expertise. They are very good at working across their system at finding ways to improve care and rolling it out across all the hospitals in their system so that everyone improves together. This is a big one. They're going to invest $1 billion over the next 10 years in our health system. That's billion with a B. I know now that the government's sending trillions, that sounds like nothing, but billion's still a lot of money in the healthcare world for a hospital. And when we look at our organization, we have the Heart and Vascular Institute's about 12 years old. It opened when I got here. But the other building, the main building, is 50 years old. And during the whole 2020 time, we had some folks come in and look at our organization and say, what do we need to be investing in that old building to keep it up to date? And it was about $500 million to bring that old facility up to date. It looks good. I mean, it still operates fine, but there's a lot underneath the skin there that needs work on. So with that $1 billion commitment, we can take care of all those issues we're having with the old facility. Keep local representation. We'll continue to have a board. There'll be 3 Piedmont members on the board and 10 local board members from our current board. We also will have actually 2 folks from our board on the main Piedmont board. So we'll have some input at the system level as to what's going on. They're also going to invest $2 million more per year for the next 10 years in the things we do. Like, we fund a lot of clinics, and we try to do things for the folks that are underserved in this community. Piedmont stepped up and said, we'll do what you're doing today, and we're going to add $2 million a year to that. So it will enable us to actually support organizations in this community that are trying to address all those inequities of health that we see across our community. So that's pretty cool. And then the other thing is, and this is very important because Lori's here, she's the fundraiser for our organization. And what we have is with the University Healthcare Foundation, the monies that they've collected stay here. They do not go to Atlanta, they don't go to Athens, they don't do to Columbus, they don't go anywhere, they stay here. And any money that Lori continues to collect will stay here. And we still need philanthropy in this business, unfortunately, to keep us up to date and moving forward. So what does it all mean for patients, which is the most important thing is our patients? Patients will continue to see the same physicians, same caregivers in the same facilities they saw yesterday, they'll see tomorrow and going forward, although we might dress some of those facilities up. Clinical services per the LOI do not change for 10 years. So it isn't like, well, gee whiz, you guys do heart surgery today, we're going to do all those in Atlanta. That isn't happening here. Piedmont is very, very committed to keeping services close to the people's home who are desiring those services. So for 10 years, nothing's going to change from our clinical services. And indigent care policies, they've said if our policies are more liberal than yours, we'll use ours. And if yours are more liberal than ours, you can keep those policies. So we will be no less generous than we already are on charity care. For employees, all employees get to keep their job for at least a year after post-closing. Believe me, in this day and age, if you're a healthcare worker, your job's really secure. I can't imagine someone taking you over and laying a bunch of people off. Probably ain't going to happen. For physicians, nothing really changes for doctors. The medical staff bylaws stay in place. Everything stays the same. The only difference is they now have access to becoming part of the Piedmont Clinic, which is the largest integrated health network of physicians in the state of Georgia. I think with our guys, they'll be up close to 3,500 to 4,000 physicians all working together. For the community, I think this ensures that a high quality provider will be in this community for a long time. Because, being a hospital today is not a guarantee that you're going to be around here tomorrow. It's not a guarantee. So I think this is a guarantee that we're going to have great healthcare here in this community for a long time. It ensures excellent facilities and technology that are kept up to the state of the art here with that $1 billion commitment. And I think this is something that we don't talk a lot about, but I think it brings a recognized, trusted name in the healthcare community on a national basis to our community, which I think will enhance us in being able to do more economic development kind of projects in the future. When you say Piedmont's here, people will probably recognize that name. The next steps, the LOI was just the first step. So that we have although I will tell you, it's one very specific LOI. We spent a lot of time crafting it so that the next step is easier. So the next step is to do due diligence. where we kind of open the kimonos up and we say, this is what we are, look at our audits, look at our financial statements, look at all this, look at our contracts, lawsuits, all that good stuff. And we look at theirs to make sure that they're all what they're supposed to be. And after due diligence, you have the definitive agreement. The definitive agreement is actually the documents that merge the two organizations together. That's a lot of legal fees to go through there, I can tell you. But once that's done, then what actually happens is the definitive agreement has to go to the state's attorney general. So in the state of Georgia, all not-for-profits are underneath the attorney general's kind of purview. And his job is to make sure that the deal's fair for the communities and that things moving forward make sense. So that all happens after we have the definitive agreement. So it's far from over yet. But universities, we're still very proud of what we do and who we are and proud of our history. Our success here is due in large part to our commitment to fulfilling our mission to improve the health of those we serve. We think we now have the opportunity to seize the future and do it in a bigger and better way going forward, and certainly a much more secure way. And then I've got a couple of questions I get asked a lot. First off, who made this decision? Some people might want to know who made the decision. This was made based on our board. Our board made this decision to go forward. And they used certain questions as to who because we had several organizations very interested in this right down to the wire. And they had to evaluate them on criteria. And the first thing they want to know is who can preserve our long-term financial viability. The second thing that they were kind of looking at from a primary stance was who can enhance university's current patient quality of care. And then the third thing was, how do we keep talent in this community? Physicians, doctors, nurses, maybe even a CEO or two. And then some of their secondary evaluation characteristics was who can enhance our regional relevance with payers and politicians. Also, who could we take advantage with on a risk-based population health management format going forward? And then who could support our business intelligence services? Let me tell you, we got data coming out our ears, but how you transform that into intelligence and where you're going and what you need to do, it's a big leap from there. So we found that some of these bigger systems have incredible tools to help you run the organization. Is Piedmont buying university? The answer to that is no. This is a merger. And University Healthcare System actually doesn't even own the hospital. They lease it from the Richmond County Hospital Authority. So at the end of the day, Richmond County Hospital Authority still owns the business, but their leaseor will now be Piedmont instead of University Healthcare System. And what's really neat about that is at the end of the lease, all the assets revert back to the Richmond County Hospital Authority unless they want to extend the agreement. And that would not only include where it is today, but it also includes the $1 billion they're going to put into the system. So it's a good deal for the local community. Is University partnering with Piedmont due to financial issues? Let me tell you, we're still very strong. We have an incredible balance sheet at University. We're still very strong. Moody's and S&P, as I said, just re-rated us. We're in good shape with those folks. But yes, it is a financial thing. It's about looking in the future is how do you create an operating margin in the business we're in? We have to find ways to improve net revenue collections and decrease cost. And we've squeezed the grape about as far as you can squeeze it right now. And we think that Piedmont can help us squeeze it a little bit more. Who will be in charge once this is finalized? Lori. Lori's going to be in charge because she's in the Kiwanis Club, so Lori's in charge. They've committed to keep the local leadership team here, and we still have a local board that will be overseeing quality and credentialing the medical staff and all that. The fiduciary responsibility for the place though will rest with Piedmont Health Services, who is taking on all our debt in this process. Will universities, hospitals, and locations change their names? I will tell you that I was looking into changing the name anyways. We've been University Hospital since 1915, a long time. But since AU went through a bunch of name changes and finally wound up with Augusta University Medical Center for their hospital. And I understand that. I understand why they did that. But what it's done is create an awful lot of confusion in the market as to which hospital they're going to. You know, we each have helicopters landing on the wrong landing pads. We've got people going to the wrong ERs. It's just kind of become a mess. So I was actually considering changing the name anyways. My hunch is it'll be Piedmont Augusta when we're done with this. So I think that will happen. So with that, that's kind of where we are. I hope that kind of enlightened you a little bit on what's going on, why we're doing it. But I think it's a great deal for not just university, but I think it's a great deal for this community in the long run. So with that, I will answer any questions you might have. Pete?
Jim, as a percentage of revenue, will the present university healthcare system fit at Piedmont, larger Piedmont?
Oh, boy. More maybe a 10th, maybe a little short of that now, maybe a 12th. It's a very big health system. It really is.
If it measure of influence.
Yeah, but we're probably right around, I'm guessing 1/12 maybe, yeah, somewhere in that range. Yeah. Yep. Yes.
This week I was out in Abilene and checked out the new Amazon.com fulfillment center out there.
Yeah.
Amazon.com folks are here in town. Have you been able to get in the pocket of Jeff Bezos, or the pocket of his ex-wife who's been giving away money like crazy?
We have not, but we're going to try. That's Lori's next job.
What is Piedmont? You mentioned that you're tracking talent, recruiting, things of that nature. How does Piedmont stack up compared to y'all in terms of that? What is their reputation in terms of?
Yeah, I keep forgetting I'm supposed to repeat the questions. All right, I'm sorry for all the folks online. The question was, how does Piedmont stack up to recruiting people and services online? I would tell you it's difficult for even the big guys, but Piedmont, they've got a lot going for them. Number one, they're nationally recognized. They're nationally known. They have some tremendous services. Their heart services, that's actually who we refer you to if we can't take care of you. We send you to Piedmont in Atlanta. We have a big connection with them. So they have a name out there. They also have Atlanta. When you're trying to recruit young physicians to your market, a lot of those young guys coming in and gals coming out of residencies and things, they're looking for someone to, a husband or a wife, and it's hard to get them into the smaller towns than it is in the big towns. So they have a much broader reach than we have for attracting talent. Yeah.
What are some of the other communities or systems that are part of Piedmont?
So what are some of the other communities or systems that are part of Piedmont? Of course, you have the downtown Piedmont down in Midtown there. It's a huge facility, but they took over. I think their first acquisition was Athens Regional, up in Athens, Georgia. Very good hospital up there. They're down in Columbus, Georgia. They have a big hub down there. And then there's like a Walton, there's a Noonan, they're spread all over the middle part of the state. Yeah.
Will Shepherd's be a problem? This is part of Piedmont.
Well, Shepherd, no. I think they're a standalone system. Yeah, but I think they stand alone, if I remember right. Yeah.
It's industry trends. Talk about the industry trends between for-profit and nonprofit. Because it was important for you to remain nonprofit.
Yeah, the question was talking about industry trends for-profits versus nonprofits, and why was it why did we want to stay not-for-profit? Well, the industry trends are probably the same for both. Decreasing revenue per unit of service impacts both sides of the fence. And rising costs are going up for all of us. And most of our costs, even for the big for-profit organizations, is still labor. And as labor becomes more scarce, that price increase is going to go up. I can tell you during COVID, since COVID started in March of 2020, our nursing costs have gone up 18%, that much in that short, because there just aren't enough nurses. So you just keep, we keep trying to pull people from all the different systems. It's kind of bad. For-profits, they have the same kind of problem. What for-profits have, and I think HCA, who owns doctors, probably does it better than anybody, is they've been able to take the advantage of being a system. I think they have almost 150 hospitals in their system, and they control costs incredibly well. They leverage the suppliers well. There's one way to do things. They do it one way. I think they do it better than a lot of not-for-profits, but what they don't do as well is make themselves open for more charity care, taking care of the folks that, unfortunately, we still have people that are underserved across the whole country. And, in Georgia and South Carolina, where we have not advanced Medicaid, that burden of taking care of those folks still exists for a lot of not-for-profits. So I think that's the big difference. The other difference is that the monies earned in the business stay in the business versus the monies earned in the for-profits can be sent out to shareholders. It's not bad. I'm not criticizing them. It's just a different model. Our board chose to, we're big about, we improve the health of those we serve. We never said those with insurance, those without insurance. We say everybody, we take care of everybody. It's just part of our DNA, and we wanted to keep it that way. So good question though. Any other questions? Yeah.
But Jim, if the downward pressure on revenues continues out into the future, just crystal ball out in the future, and there's upward pressure on costs, consolidation is it solves the problem in the short run because you're able to share costs across a larger network. Going out in the future, is this just that kind of kicks the can down the road, right? Or does this just continue on?
Yeah, so the question is if the revenue lines dropping and the cost lines going up, while consolidation can solve the problem for the shorter term, long term, where are we going? That's true. I agree. But I think there's a lot of meat on the bone to reduce costs going forward. So I told you up front, if someone tells you where the future of healthcare is going, don't believe them. So you probably shouldn't believe me now. Somewhere along the line, we're going to have to come to grips with how we fund healthcare. Medicare is rapidly marching towards insolvency. And I've heard of things as early as 26, 27. Medicare may go broke because you got this huge bolus of baby boomers. Like I'm in the middle of the baby boom. So this baby boom thing's got another 10 years to go. And, with, 13,000 baby boomers join Medicare every day. That's all. And we live forever now, or at least the baby boomers think we're going to live forever. We're hoping anyways, we're keeping hope alive on that. And the old folks aren't dying quite as quickly as they used to. It's not unusual to see 90-year-olds today. I remember when I was growing up, my grandparents were probably in their late 50s, early 60s. And it was always, we got to go see them because, they may not be here next year. You don't hear that anymore. People live a lot longer. So you got people living longer, very expensive folks to keep alive, by the way, and more of them coming. So we're going to have to address that. And right now it's very difficult to do because in the competitive environment we're in healthcare, people are still going after different kinds of business differently. So I think eventually, I hate to say this, but I think you're going to be looking at Medicare for all eventually. It's cheaper to manage the money in Medicare. They don't pay well, but they pay quick, and there's not a whole lot of hassle there. Versus this huge 30% of the business is just mushing the money around. The United Healthcares, who by the way made $5 billion last quarter. Last quarter they made $5 billion profit. Where'd they get that? Their Medicare Advantage plans. And where'd they get it from? They got it from me. And that's not good because they're not actually providing care to you. So I think eventually, unfortunately, the greed is going to lead us towards more of a national system than we have today. And there will be add-on insurances to go on that if people want more luxury, in their healthcare or whatever. I think that's where it's going to head someday. But as Winston Churchill, I believe, said, the Americans eventually do the right thing after they've exhausted all other possibilities. That's kind of where we are today. And we have kind of the money going into the administration of healthcare instead of into the provision of healthcare. And eventually we have to get back to that. Other questions? Thank you.
Thank you so much, Mr. Davis. Thank you for all you do for the community. And when you go to sign that agreement, here's a Kiwanis pin for you to do that.
I'll pull that up.
Okay. Derek, you have a guest, and I did not get you to introduce your guest at the beginning.
My guest is Brandon Garrett.
And they're dressed alike, so if you guys haven't noticed that. So they're not self-conscious about it at all, so don't point it out. Okay, so our next meeting will be July 12th. Our speaker will be Britton Williams, the new mayor of North Augusta. Just as a reminder, we'll continue to meet on a bi-weekly basis through September here in the Palmetto Terrace Room, and lunch will begin at noon. To keep our bi-weekly schedule, we would ordinarily meet on July 5th. But that conflicts with the July 4th holiday, so we will meet again on July 12th. I'm going to end with a thought for the week, and then also a joke for Jeff, and then Jeff's going to coordinate our big selfie at the end of the meeting. So if you want to come up here, you can kind of make your way up here to do that. Okay, so the quote / thought for the week comes from the late President Ronald Reagan. Let the 4th of July always be a reminder that man is born with certain God-given rights and that government is only a convenience created to manage the people, with no powers of its own except those voluntarily granted to it by the people. We sometimes forget that great truth, and we never should. Okay, and here's my dad joke in honor of Jeff Aslan to go along with the patriotic theme. How come there aren't any knock-knock jokes about America? Because freedom rings. See, Jeff, I did pretty good there. Okay, hope to see everyone on July 12th. Have a wonderful 4th of July, and let's all squeeze together for celebration of National